So good morning students. Today I am going to demonstrate the procedure related to the bed sore. So let's see the articles. First draw sheet, then Macintosh and Dettol's and any antiseptic solution and sponge holding forceps and artery forceps and hand washing and ointment, betadine and other cotton balls, kidney tray and normal saline. These articles we needed for started the bed sore, for giving the care of the bed sore. So let's start the procedures. So before the procedures we know about something regarding the bed sore. So a bed sore is also known as the decubitus ulcer and pressure sore and pressure ulcer. So many there will be having the many names of bed sore. It is a localized injury to the skin and underlying tissue, usually over a bony prominence as a result of prolonged pressure function of shear. So we can start the procedures over here. When tissue do not get enough oxygen and nutrition due to the proper blood flow, and skin starts breaking down and leading to ulcer or open wounds, bed sore not only cause pain and discomfort but also increase the skin of infection and delay healing and complications if not managed properly. So that is the bed sores. We have to give these types of care. They are most commonly seen in the elderly, prolonged patients and unconscious patients and chronicle ill patients, and their preventions and early management is an essential part of the human care. It is very important. So let's start the procedure. Firstly, we have to put the Macintosh under the patients where we have to give the cares of bed sores for prevention of any type of bed, any type of wetness, any type of liquid if there will be falling over there, so we can prevent with the help of Macintosh. After that we have to visualize the area where we have to give this care. We can separate all clothes from there, and with the help of normal saline, we have to take the normal saline with the help of sponge holding forceps and cotton balls. Like this we can assess firstly if there will be having any bad skin, any bad particles in their skin, then we have to remove with the help of artery. If there will be having any unhealthy skin, then we have to remove that first. After that we have to clean the normal salines in a rotation movement in a one stroke. Like this we can clean that wound with the help of normal saline. Like this you can clean that wound. After that we have to take the antiseptic solutions, any uh, it can be Dettol and betadine. We have to take this, and same procedure we can follow with the antiseptic solution also, in a rotation movement, one stroke, one time. After that we can apply the ointment. It can be betadine or as prescription by the doctors, we can apply on this wound. And with the help of cotton balls and sponge holding forceps, we have to dry this wound. We can't leave it in wet area. So firstly we have to dry this wound. After that we have to cover with the gauze. After that we have to cover with the gauze properly. And cover the patients over there. Like this we have to give the care of the patients for the bed sore, for prevent the bed sore. If we have to talk about some theory, so you can see this picture, that is the first stage of bed sore. In first stage of bed sore, when we have to talk about the first stage of bad sore, so skin intact but show redness. There will be present the redness, but skin is not break up. It is the intact. Area may be painful, firm, soft and warmer or cooler, compares to surrounding tissues. That is the first type of first stage of bad sore ulcer. When we have to give the care in first step of bad sore ulcer, so intact skin daily, especially over bony prominence like heel, hips, sacrum. Identify stage and risk factor firstly. So daily, you can check the patients on these areas. And pressure relief, for pressure relief you can give the positions, you can change the positions every 2 hours of patient. And use cushions, air mattress and water beds for that patients also. And keep patient body aligned to reduce frictions and shear. And skin care, when we have to give the skin care, keep skin clean and dry firstly. Use mild soap and lukewarm water for cleansing that area. After that, apply protective barriers, creams or powders, or like these type of items you can apply on these areas. And prevent from the first stage of bad sore, which is very painful. And mostly bedridden patients may be high risk of having this bad sore, uh, like uh, like you can see the paralyzed patients, elderly patients, है ना, or chronological patients, ill patients. So these type of patients is, so these type of patients it more chances for having this bad sore. And we can prevent these all things, what we have to already discuss in the first stage of bad sore. After that we have to talk about the second stage of bad sore. You can see, so you can see this picture. Then the picture is showing the second stage of bad sore. In second stage of bad sore, when we can talk about the loss of epidermis and partially dermis. The epidermis layer and partially dermis layer it involved in this stage, in the second stage, appears as a shallow open sore with a red, pink wound, bed or blisters also present in this. You can see this picture easily. This is the second type of bad sore ulcer. And same procedure we can follow, which we have to follow the first stage of bad sore ulcer and prevent patient from any type of infection over there. And change the position every 2 hours. Same, you can use this condition also. And use cushions, air mattress or water beds also. And keep patient body alignment to the reduce friction and shear. Keep skin clean and dry. Use mild soap and lukewarm water. Apply protective barriers, creams and powders and oil, whatever you want apply at that time. Clean ulcers and normal saline with the prominent solutions and apply the powder. And more dry the skins every time. And dry their cloth. And the patient bedsheet is also clean and dry and free of wrinkles over there. So like these types of management can, you can give that type of patients which is suffering with the second stage of ulcer. So if you have assessed these type of ulcer, you can see in this picture like this. If there will be having, if there will be present with any patient's body, so that is called the second stage of bad sore. After that we have to see the third stage of bad sore. You can observe. So when we have to talk about the third stage of bad sore, in third stage of bad sore, damage extends into the subcutaneous tissues. Fatty may be visible. Fat, you can see the fat. You can see these pictures. The heel is prominent over there. So you can see the subcutaneous tissue is also absent in this picture, and fat may be visible, but bone tendons or muscles are not exposed. In third stage of bad sore, maybe include tunneling and under dreaming conditions. There will that conditions we can see in this third stage of bad sore. Same procedure we can follow with this also. Clean ulcer with normal saline and prescribe solutions, any type of solutions. And apply appropriate dressing, hydrocele foam, aligned and medicated as per the stage. you can apply any type of dressing over there, and try to dry this wound, and give healthy nutrition to the patients, healthy nutritions, vitamin C and zinc, high rich diet you can provide for this patient for the prevent as soon as earlier for the third stage of labor. So you can see this it very easily. So it can prevent also infection control, monitoring for signs of the infections, redness, pus, fall, odors and fever. Now we have to move for the fourth stage of bed sore ulcer, which is very dangerous in for any patients. And so when we have to talk about the fourth stage of bed sore, in fourth stage of bed sore, damage extends to muscles, bone or supporting structure, and also sludge of the scare may be present over there, and often associated with infection and deep tunneling in the fourth stage of bed sore. Step of bed sore, if we can give the care of the fourth stage of bed sore, then same procedure we should follow again, which we have to already follow in the third stage of bed sore. So in fourth stage of bed sore, firstly we have to clean ulcer with normal saline or prescribed solutions. After that we have to apply appropriate dressing like hydrocolloids and foam, and alginate medications as per the stages: betadine ointment, betadine liquid, any other ointment which prescribed by the doctors. Then remove necrotic tissues, debridements if required. If there will be having any bad tissue or any damaged tissue, we should remove firstly that type of tissue over there. And with this treatment we can also assess, we can also give the health educations regarding the nutritions, like provide high protein rich diet, and vitamin C also involved in the diet, and zinc rich diet, and ensure proper hydrated that is skin. We can also ensure with this. And infection prevention health education also provide for these type of patient, like monitoring for the sinus for infection and redness, pus, foul discharge, foul odor, fever, like this type of conditions we can assess. We can give the health education on this also, and administer antibiotic if prescribed, if needed. Then we can also provide the antibiotics and other medications for pain relieving, and for drying the that wound, and use sterile dressing techniques. This is also very important. And education and prevention also very important for the patient's caregiver, like teach caregivers about repositioning and skin care, like every 2 hours we can change the position of that type of patients, and encourage the immobilizations of the possible. You can encouraging that the patients to mobilize to doing any activity that from that area. So if we can talk about the bed sore ulcer, they are most commonly seen in the elderly, paralyzed patients, unconscious patients, and chronologically ill patients. And other prevention and early management is an essential part of the nursing care for the bed sore ulcers. So there will be having the 4 stages of bed sore, and every stage is very dangerous, and third and fourth stage is needed to the healthy nutrition, and proper following the dressing and wound care, and dryness over there, healthy nutrition, infectious free. These type of conditions we can apply for the third and fourth stage of labor. And every time dry the patient cloth is neat and clean and sterile, and patient bed sheet is also wrinkles free bed sheets and clean bed sheets. So these type of techniques we can apply with the patients and prevent from the bed sore. And treatment of the bed sore we can also apply like this. Thank you so much. Like, subscribe and